Hi, everyone. My name's Lindsay. Like she said, I'm an exercise physiologist at Fairbanks Memorial. What I want to talk about today is a really relevant issue, especially among Alaskans and women specifically. Our goal today is going to be understanding seasonal affective disorder and coronary artery disease. We're going to identify risk factors and then look at some preventative measures and among those topics. So what is seasonal affective disorder or seasonal depression? It usually affects patients among winter months, so September through March, most severely November through February. And I think we all know when it's really dark in the wintertime, it's about November through February where you're like, oh my God, I don't think it's ever gonna end. So it's induced from decreased sunlight exposure during certain times of the year. There's about 30 minutes of sunlight, it feels like, from November until March, and then you actually see sunlight again and you think, oh wow, it actually exists. So that being said, it is classified as a mood disorder. And so it affects usually your moods, your temperament, and a lot of your patterns. However, the good thing about it is it's usually resolved with the weather. So as you see more towards the end of March and April and May, the sunlight starts increasing, you get outside, you're able to exercise, you're able to do your normal habits, and your symptoms start to resolve. So that being said, what are the symptoms of seasonal affective disorder? The biggest thing is social withdrawal. So you don't want to do as much as you'd want to do. You don't get out with your friends, you stay at home because it's cold, or the weather sucks, let's just be honest. You wake up one morning and it snows 18 inches, or it's 45 below, and it makes you not want to get outside. The next feeling that you get is a lot of depression. So depression, anxiety, feeling down, hopeless, little interest in doing things. So there's not a lot of interest in doing your natural hobbies, whether that is getting outside or walking your dog or going on hikes because you can't. And that leads to a lot of inside work, which leads to a lot of weight gain. I think all of us as women know that there is that shift during the winter months of about 5 to 15 pounds. All of us experience it. It is really, it's normal among Alaskans to have that kind of shift in weight, but it's being more aware of it and how it can induce those risk factors. Little concentration. So we know that concentrating is difficult, and when there's no sunlight, it's even more difficult. And when you're sitting at work and you're trying to get all of your stuff done, and you're sitting at the computer and you're like, I didn't remember what I was doing 30 seconds prior. How we're able to kind of control that lack of concentration and willingness to keep going is the next part. And that kind of changes in your sleep patterns and your mood. So in the wintertime, you're gonna sleep a lot longer. I know that I do personally. You go from sleeping like 7 hours in the summer to like 11 hours in the wintertime, and it just feels oddly appropriate. You wake up at 11 a.m. and on the weekend and you're like, I feel like I should still be in bed, but it's way too late to be. So then you start noticing that you're staying a lot longer in bed, and you're feeling like less lethargic and drowsy, and you're not understanding why you're not having that energy. And that starts affecting your mood patterns. And so those mood patterns are feeling irritable, changes in hypersensitivity of your emotions, sad, overwhelmed. So then you have your decreased energy because you're laying in bed, you're not getting outside, you're not doing the things that you love to enjoy. There's not a lot of energy to keep you going. So you compensate with a lot of caffeine. And I know I do in the wintertime. And I try not to, it's hard, but when it feels like it's so dark and you're like, I really need that second cup of coffee, maybe a third, just to function throughout the day. But in the summertime, you don't feel that way, you know? It's always like, it's crazy the amount of things that you can get done with a little bit of sunlight. The biggest thing though, when you look at all 6 of these factors and these symptoms that you have, it leads to the biggest one that I feel is most important, and that's suicidal thoughts. So Alaskans, we know that we have the highest rate of suicide per capita. And that is something that I really, really would like to strive to decrease. Mental health is such an important factor of your life, your body, your mind. And yet it's not treated enough and taken care of enough. So we have these thoughts, we have all of those other factors. You're socially withdrawing, you're feeling depressed, you're gaining weight, you don't have concentration, You have your change in sleep, decreased energy, and then you just feel like there's not enough left, right? There's not a lot to keep you going, and it's 45 below on top of it. So things that I like to think about is how can we decrease that? What are ways that we can go into? And that's how I think about how is it treated. So there's many different options to treat seasonal affective disorder. And the ones that I'm gonna present today, it's no specific order in how they're gonna go. It's just ones that I found that are most relevant. So medications, obviously we know that there's medications available to treat. Most commonly is your selective serotonin reuptake inhibitors. So that's your Celexa, your Prozac, your Lexapro, most common drug names. Basically what those medications do, or SNRIs are antidepressants, and what those medications do is they just increase that concentration within that neuron and hopefully gives that body a little bit of ounce of hope. So you have that little bit of hope that's released into those neurons, and then you say, oh wow, I feel a little bit better. And a lot of patients that I've seen, even in cardiac rehab, they just do it entirely during the winter months. So when they become symptomatic in the fall, they start a small dose of medication, and then by the time spring comes around, they wean off of it because they don't need it in the summer. And so that's a good indicator too of knowing how your seasonal affective disorder affects you personally, is knowing, okay, I do a lot better with medications, or I do a lot better with this. And so the next thing that I think is one of the most beneficial, and I'm not sure if I'm biased, but it's exercise. So our body itself produces a lot of stress hormones when we're sad and we feel bottled up inside. And so we have a lot of cortisol from our adrenal glands and stress hormones from our pituitary and our hypothalamus. And ways that we can increase that is metabolizing it, right? So increasing your body's energy, getting out, walking, even for 10 minutes. So it's been shown over time that even if you get out for 10 minutes of just walking around when you're feeling really overwhelmed, is going to give you a boost of energy and help you feel less stressed because those hormones are decreasing within that system. And then another way to do that is yoga and meditation. So I'm a huge advocate for meditation. I listen to sleep meditations all the time, especially during the wintertime. We all know that our sleep's disrupted, and sometimes it's hard to fall asleep or stay asleep. So I think meditations are really, really important for your mind and your body. Yoga is also a really great one. So not only does it keep your joints very fluid during that time and lack of exercise, but also it helps you relax and it helps you really kind of find that Zen moment in with yourself. Another big thing, and I know that we see this a lot, is light therapy. So a lot of us at work or on our desks have our little happy lights. And even sitting in front of it for 15 minutes a day is beneficial, right? It's sometimes can be a little hard because it's really bright and it's really in your face, but it is beneficial. It does give you a little bit of artificial sunlight throughout the year. But it can be hard. And so it's not a lot of patients are really susceptible to doing it because it's just very obnoxious, but it is something that is beneficial to talk. My favorite one, psychotherapy. I think that it's a very great tool. I think being able to talk with somebody about the feelings that you're having, the emotions that you're feeling, being able to have an unbiased person talk to you about those moments and those stresses that you feel, especially during wintertime. I always encourage people to reach out. There's tons of resources online, not so much in Alaska, but we'll talk about that. But most importantly, reaching out and making sure you feel okay. And then also vitamin D. So vitamin D is a really important factor. Obviously, we know as Alaskans, we're chronically vitamin D deficient. It's really important to take a daily dose of vitamin D, whether it is a 2,000 or a 5,000 international unit dose as a baseline is really, really important as us as people, and taking care of our bones, taking care of our mental health, taking care of our bodies. It's a really essential part of living here in Alaska. Does anyone have any questions so far? Okay. So the next shift of our topic will be coronary artery disease. So this is kind of my realm of things. I deal with a lot of patients that have coronary artery disease, heart failure, post-MI. So it's a good topic to talk about and really bringing awareness of what your body does and what those vessels are doing. So what is it? It's plaque buildup within the vessels supplying oxygen to the heart. So as you see, we have a nice normal artery, and then you have the narrowing of the other artery. And so you have that nice liquid deposit of plaque. And so what is plaque? Essentially, it's cholesterol deposits in the arterial wall that cause inflammation and narrowing. So as you have these little tears or inflammation or disruption within your artery wall, your plaque and your cholesterol decides, I like that. I think I'm going to call it home. And it starts building up nice and tight right inside those walls. And so that starts to lead to what is a blockage. And so you have your normal function at the top, and then you have that dysfunction of where your vessel wall starts to kind of get irritated and inflamed. And then you have that plaque formation. So there's two types of plaque. There's stable plaque and then there's unstable plaque. So stable plaque is what can form over a long period of time, and it lightly lines the vessels and slowly increases. Unstable plaque, which we've seen over winter time and with patients, is that you have significant weight gain, you have significant changes in your diet, whether it be high saturated fats or substance abuse. And so you start to see that these plaque starts building up very quickly and significantly. So then as that, it becomes unstable and it starts to break off. So when it ruptures off that wall and breaks off, your body, like anything else, is gonna have, like when you get a cut or a bruise or whatever, you're gonna form a little clot. And you get scabs over. Just like the outside, it'll do the same exact on the inside. So you have this blood clot that forms, which is called a thrombosis. And it says, I want to heal you, and I want to fix you and make you better. But in turn, it does not make it better. So the blood clot's just going to be becoming larger, and it's within that wall where it says, I just want to keep trying to fix you. And as more breaks off, the clot starts to get better and starts to form until eventually the entire artery is occluded. And so if there's no blood supply and no blood flow through that artery, there's no oxygen. And if there's no oxygen being supplied to the heart. And so that ultimately leads to our biggest thing here, which is what is the result? A heart attack. And so you have this blocked artery, and then you have muscle damage. So if we know as human beings we have to breathe and we need oxygen to survive, so do our muscles, right? So if our muscles don't have oxygen, the tissue starts to die. And that's our most important factor when we have someone coming in with a heart attack. It's being able to know it's a heart attack, treat the heart attack, and reevaluate those or initiate the oxygen to that heart muscle. So next things to kind of talk about is how seasonal affective disorder and coronary artery disease are related. So they kind of overlap with each other. Most people that suffer from seasonal depression have an increased risk for developing coronary artery disease. Why is this? It's a lot of it's decreased exercise, poor diets, and your decreased serotonin levels, right? So you don't have a lot of sunshine, you're eating poorly because it's winter and you want to stay home and be easy. And you're not getting outside and you're not exercising enough. And then a lot of it is coming down to the fact that it's overlapping symptoms. So a lot of seasonal affective disorder and coronary artery disease present the same way, especially in women. So why does this affect women in Alaska? One, we're more susceptible of getting seasonal depression. It's dark, it's gloomy, and it snows a lot. And sometimes the weather is not very fun. So what does that in turn lead to? So obviously a lot of women in Alaska are susceptible to weight gain, your mood changes, changes in diet, and then your sleeping patterns like we had talked about before. These are all really big factors in the fact of your overall health and making sure that you keep those in check. Then we talk about the heart disease part. So we all know that women go more undiagnosed with coronary artery disease or heart disease in general than men. And that's because our symptoms are presented a lot different. So these milder symptoms and then the mass symptoms between seasonal affective disorder, it comes into this saying of how can we look at these together and what is the risk factors of it all? So our risk factors and our symptoms of coronary artery disease are indigestion. So a lot of women get reflux symptoms. And we all know that if we eat really spicy foods or we drink alcohol, you're going to have that indigestion feeling. And you're like, oh, I have reflux again. And so you take medication and you're like, oh, I hope it goes away. And then you realize, oh, I still have this reflux and I still have this reflux. And then it's still persistent. And that's where you have to realize maybe it's not reflux. Mild back pain, fatigue, lack of energy, and just shortness of air. So you're not going to have your atypical symptoms of a heart attack like men do, right? Your severe chest pain, shortness of breath, arm pain, radiating jaw pain. Those are all more your typical symptoms for men, but for women, it's a lot milder. So why do these symptoms overlap with each other? Women develop non-obstructive coronary artery disease more commonly, and we call it microvascular. So as you can see here, you have your main coronary arteries, the big ones, and then you have those small vessel feeders on the ends. And that's where usually women develop those feeders and the obstructions within those vessels. And so as it's not completely entirely blocking off the ability to give oxygen to the heart, it makes those symptoms like, oh, there's something there and I feel weird, but I don't know what it is. So that being said, seasonal affective disorder, people are still going to exhibit the same symptoms. You're going to say, well, I feel fatigued and I'm tired and it's dark outside and maybe. So what do these have in common and why does it matter? We all know that mental health resources in Alaska are very scarce, and it is really hard to find not only help, it's hard to find resources, it's hard to find family medicine providers. The ultimate opportunity is to be realistic in the help that you can get. So I know that we have a lot of issues or struggles with getting appointments. And a lot of my patients that have even reached out to us for help, they say, oh, it's 3 to 6 months out for me to get an appointment. And there's no point, I can't get any help. And so there's tons of online resources. I always encourage patients to reach out to online providers. There's always telemedicine. There's tons of things in different areas that can give you a little bit more resources than what necessarily Fairbanks can offer. And it's just because we have a smaller provider source for a larger patient population for our community. So that being said, untreated mental health disorders, we all know it leads to weight gain, decreased activity, isolation. So you want to isolate yourself when you're not feeling your best, when you're not up to your mental standards of what you usually feel. Decreased activity, so you're staying inside more. And then that makes you just not want to get your care. So it's almost like this spiraling effect. As the worse you get, the less you want to get help. And your mental health decreases and the less you want to go to the doctor. And so you're starting to get these symptoms and you're like, well, I think it's just because I'm feeling so bad about myself. But really, it's more probably a heart symptom. And this is where we all have to take into consideration. Am I really truly having a mental health crisis, or am I having symptoms of cardiac disease? So ignoring the symptoms due to mental health or attributing them to the current state that you're in. Those are really big things that we like to talk about. So who is at risk? Women in menopause. The funnest part about getting older. It's a scam. So as we know, women in menopause, we have decreased levels of estrogen. And so with those decreased levels of estrogen, you're actually going to have an increased reuptake of your LDL, which is your bad cholesterol, essentially. So as women get older, you have a more increased risk for cardiac disease because of the fact that your cholesterol is not as great and your ability to reabsorb your good cholesterol is less, and you start to increase your ability of your bad cholesterol. So when you start to look at those factors and the fact that you're getting older, which is not fair, then you think, that kind of puts me at a risk in a different category. And then you think about diabetes. So a lot of people, especially wherever you go, have diabetes, whether it's type 1 or type 2. It is very important to manage it well. Diabetes has a very big correlation with heart disease. Chronically high blood glucose levels really does increase your risk for a heart attack. Being overweight. So making sure, not that I entirely believe in the BMI system because it doesn't account for muscle mass and things like that, but it's also being attributed to what is your overall health? What is your current standard? Are you overweight or are you morbidly obese? Like, where does that standard fall in that line? And making sure you're understanding what only your health is and how you can attribute those factors. Another big one, chronic stress. I'm a chronic stressor, and I admit it. I stress about everything if I could. And that's about, I think, every woman possible. So that's a really big risk factor, is chronic stress. And finding ways that we can reduce our stress is such a big deal. There's a lot of things out there. Like I said, yoga, meditation, exercise, totally great options. Lack of sleep. We need sleep to function. Our bodies require a solid amount of sleep, and good sleep for that matter. Not just every 45 minutes where you start waking up and you're starting to get older and you have to pee every 3 hours, and that's, absolutely unfair as it is. So then you're saying, well, I'm not getting solid sleep. How can I change that? And so we kind of look at those attributing things to poor nutrition. Again, we have, I think obviously all of us know, with the cost of groceries right now, they are absolutely insane. So it's easier to do the shortcuts because of how expensive it has gotten to grocery shop. And how can we fix that attribution to that? And then ultimately, my favorite part, lack of aerobic exercise. Aerobic exercise can be tied back to a lot of those risk factors and how we can decrease them. And I know everyone's like, oh, exercise, but I am being very serious in that exercise can really help your overall body health. So biggest part, ways to reduce these factors. Exercise, I know, exciting. So American Heart Association suggests 30 to 60 minutes of exercise 5 to 6 days a week. You can always split up that time. So if you want to do 10 minutes 3 times a day, or if you want to do 2 15 minutes times a day, that's entirely up to you. It's about what your body allows and listening to your body. As long as you're getting above 10 minutes of that increased heart rate, you're going to see a benefit of that overall heart health. I think that even if you're able to get out and walk, it's not about a marathon. It's about what you can do. It's about retraining your body. It's all about starting slow and building up that duration over time. I always tell my patients we are always going to take duration over intensity any day of the week. If I can get my patient to walk at a slower pace for 30 minutes instead of them running for 2 minutes, I'm always going to take that because I want to see the benefit in their heart health, rejuvenating that heart muscle again, and seeing the factors of it, right? I've seen time and time again with my heart failure patients, with my coronary artery disease patients, of how much their cholesterol improves, how much their heart function improves just by the ability of them being able to increase their exercise time and being able to sustain it. The next thing that I like to talk about is eating a well-balanced diet. There's obviously tons of fads that we can go out there and say there's tons of diets that we can do and this and that. It's really never about a diet. It's about finding stuff that's well sustainable for you and listening to your body. I always say eating a well-balanced fruits and vegetables, looking at low glycemic index foods. And I don't know why, but people feel like carbohydrates are bad, but they're absolutely not bad. So ways that we can combat people that say, oh, I have diabetes, I have to really watch my carbohydrates. That's great. So ways that we have trained and we have taught our patients, especially with coronary artery disease, is that combining carbohydrates and fiber is going to be your best option for releasing glucose into the bloodstream. It slows down that process. So I always say that there's that 5-to-1 rule. So for every 5 carbohydrates, you should have 1 dietary fiber in it. And use that as a solid rule over your course of time, just to help. One, if you want to have a little bit of carbohydrates, it's going to help benefit your glucose levels, and your pancreas is going to thank you. But it's also going to decrease that insulin resistance as well. Other things that we can look at is eating whole grains. That's really important. And that's the same thing that ties into fiber as whole grains. So white rice or brown rice, always going to pick brown rice, right? Because it has the fiber in it that it needs to be sustainable. Seek help when you need it. I'm a huge advocate for this. I think everyone should be able to seek help when they need it. Reach out to a friend, reach out to a family member. Try and schedule an appointment if you can. Always feel free and be able to feel like you should be able to talk to somebody. I think it's so very important. If your mind is healthy, your body's going to be healthy. And if you can't keep your mind right, your body's not going to be right. Vitamins. So I know there's a lot of stuff out there where you can take about 1 million different vitamins and hope that it helps, in your skin or whatever it may be. Some key vitamins, though, are really going to be your vitamin D. vitamin C, and then your B vitamins. B vitamins are really regulated through stomach absorption, so it's important to get those sublingual or have a really balanced diet or decrease your stress, because the more stress you have, the decreased absorption you'll have of your B12. Vitamin C is going to help treat your immune system. It's really important. I know a lot of people are like, vitamin C, but it is helpful. It does help your immune system in the long time. And then vitamin D, of course, I'm a huge advocate for it. Everyone's chronically low in it. If you're chronically low in vitamin D, it's harder for your B12 to absorb. So those go kind of hand in hand with each other. Listen to your body. This is the biggest factor in how I tie everything up, is being in tune with it. So listen, speak, think about things. Are you really feeling like it's seasonal affective, or are you really having heart issues? If you feel like these symptoms are persistent for more than a couple days, reach out to your doctor. It's a lot easier to reach out to your doctor and be evaluated than it would be to let it prolong and then have a heart event that you can't treat, or having a massive heart attack and not making it. So I always advocate to my patients, please reach out if you need anything. Please go to the doctor if you have sudden weight gain, if you're short of breath while walking down the hallway, or you're dizzy, or whatever it might be. Always keep aside of your symptoms, and don't always just attribute them to the fact that it's wintertime. Does anyone have any questions?